Hello everyone, welcome to Cribwolf Talks. My name is Lino and I'm the host of today's program. Today I'm really looking forward to interviewing my good friend Susan Bisaillon, CEO of Safehaven. Safehaven is a not-for-profit organization that has provided residential and respite services to individuals with complex needs for over 30 years. For the record, this wonderful organization, Safehaven, is a recipient of the 2021 Children's Healthcare Canada Organizational Leadership Award. Susan, thank you for having me here at your main office here at Safehaven. I'm looking forward to our conversation. I'm going to have a few questions for you.
Great, thank you. Happy to be here today.
Great. So let me open up with the first question. Tell us about yourself and Safehaven, perhaps its mission and vision.
Mm-hmm. Well, Safehaven was originally established in the late 80s. There was a lot of work that was happening, I would say at that point, where they're really trying to deinstitutionalize a lot of the children who had disabilities and individual adults and get them more into sort of like a home-like setting. So really kind of that shift from institution into sort of in a home and a community. So Safehaven really evolved from that. There was, I would say, some significant influence from parents who had children who felt that they needed a different approach and a safety net for their children. So Safehaven was sort of established as a legal entity in 1988. So we're having our 35th annual general meeting this year. The focus was really on looking at children with developmental disabilities. And over time, the mission and the vision, which was really to create a place for these children, to give them respite, so their families could actually enjoy, a bit of respite for themselves and ease the burden of what it was caring for these children. It really took life. And then for our other locations that we have residential locations. So it was that sort of combination of respite and residential. And the residential really sort of helped support children initially who really didn't have parents often. Some of them were considered what we would say is crown wards, or, the government actually oversaw their care. So Safehaven became that home for them to live and grow. So over the last 35 years, it's just been, I would say, an amazing journey. I think many of those kids were not expected to live to 20. And I think places like Safehaven and other agencies who really embraced disability and really sort of created a really good place for them to live and grow. And now they're living into adulthood. So Safehaven now is an adult provider. So we span the life span from children into adulthood.
Very good. So you're the CEO of,
yes.
And how long have you been in that position with?
Yes. So I actually was really drawn to Safehaven, I would say probably about 8 or 9 years ago.
Right.
It was a board member who actually got to know me on another project and then really said to me, you really need to think about maybe becoming more involved in Safehaven. I'm a nurse by professional background. I'm from the East Coast of Newfoundland in Canada.
Very good.
And I also had a child who has a disability. So it seemed like a natural fit for me to actually become involved. I didn't really know much about Safehaven. And even today, that's part of our work, is really bringing the message out. So I'm glad I'm here with you and sharing about what we're doing, because a lot of people don't really understand Safehaven and the work. So we're really trying to get that message out there. So I became involved, and there was an opportunity 6 years ago to step in as the CEO. I initially came in thinking it would be an interim while they recruited their CEO. And then over time, I think the board really encouraged me to think about staying. So I'm now into my 6th year. So what started off as a temporary sort of interim role became a full move into permanent CEO. And I spent all my career in sort of healthcare. I've worked in executive roles in hospitals and academic centers. So it was a really nice fit considering where we were going.
Previously with UHC, am I right?
I worked, I originally, when I came from Newfoundland in the late 80s, I started working at St. Joseph's. I was a nurse in critical care.
In Hamilton?
No, in Toronto.
Oh, Toronto, sorry.
In Toronto. And then I moved into the Academic Health Science Center at UHN. I worked at Trillium. I worked in Halton Region, at Oakville. And from there really came to Safehaven as the CEO. So having all those experiences as an executive and a leader in healthcare has certainly helped me shape the direction of Safehaven. And I've also been very much involved in quality and safety, working with accredited organizations like Accreditation Canada. So that was a large part of sort of what I brought to Safehaven, to really look at how we advance and grow and become part of that continuum of care. Because right now there's a lot of gaps in our current care model in Ontario.
Right. A tremendous background, by the way. It's incredible.
Thank you.
You mentioned other locations. So if I'm not mistaken, you have 5 locations right now. I think, was it North York, Etobicoke, Woodbridge, Aurora, and Toronto, I guess.
Yes.
So this is your main office,
yes.
right? Are there any plans to,
Absolutely. I think, there is a long wait list, we know, for people who have disability and complexity. We're not talking 1 or 2, we're talking thousands. I think I sort of stopped counting and looking after I saw like 14,000. So over the last 5 years, it has been a really important part of our vision direction and our strategic priorities to look at how can we be part of the solution for the future? How can we expand and grow? But expand and grow in a way that really embraces the life that these individuals and their families are dealing with on a daily basis. So we are involved in several projects, one with a partner organization in Toronto for creating our first adult location. And this site that I'm here today, we have a seed grant from the Canadian Mortgage Housing Corporation to actually redevelop this site. It's currently 2 floors. It has the potential to go 8 to 12 floors.
Oh, wonderful.
And we're hoping to have at least, availability for 100 affordable housing units for this location. And we've also have a partner in Vaughan. We're very much, like you mentioned, we're in the Woodbridge region. So we have a partner in Vaughan where we're developing another site. So those sites are being looking at being ready for 2025, 2026. We have a project for 2023. And we're constantly looking at what are some of the opportunities. We know that the model that we've created for our children and adults is an excellent model. We really know that it can be scoped and shaped for any community. So the goal is to try to do that well, with a focus on quality and safety, and work with our government partners and our donors to try and realize a future for individuals so they can live their full life.
So I'm really glad to see that you're expanding, and obviously the wait list is horrendous, and we definitely need more, housing options for these individuals with complex needs. Let's hone in on the fact that you care for individuals with, that specific age bracket, 1 to 17, right? With complex needs. Why this age group? Or I understand also that you're contemplating moving outside this age group. Can you tell us why it started with this age group and specifically?
I think again, when I think back to like 30 years ago, almost 35 years ago when Safehaven started, there was many organizations that in this space really focus on different populations. At that time, there was a need for children. So the mandate of Safehaven was the under 18. So once you reach 18, you're considered an adult. So the focus was always on children.
Right.
However, when I joined the organization 6 years ago, that was one of my key areas where I said to the board, we really need to look at something different. So we changed our focus for two particular areas. One was looking at that age spectrum. So we wanted to create that safety net for children once they aged out, that they had a nice landing into adulthood. So that was definitely a key piece. So we did, have that approval in 2017. That was part of our strategic plan back then. And we also have gone through the government quality assurance measures, which is so that you can be licensed as an adult provider. So currently, 4 of our 5 locations, we are licensed to be an adult provider, and we did that in the last few years, achieved that. Okay. So what initially started as 18 and under, like you said, 0 to 17, has expanded now to being the whole plus age spectrum. The other key change is when I joined, a lot of feedback I received from families where we were not really, I would say, adapting to what they needed in terms of complexity. So many of the kids who are very complex, these are kids who are on technologies to maintain life support. It could be a ventilator, it could be trachs to protect their airway, children who can't sort of master sort of chewing and swallowing, who are on G-tube feeds, people who have different types of conditions. We've really embraced that, and we've really, I would say, upscaled our education and our recruitment. So we have more nursing and who help care for those complex kids. So we have the whole spectrum now. So we have children, adults, and we have children, adults who are more complex, and we have children who have complexities. And as you know, that many of these individuals, it's not just one thing. Mm-hmm. It's several things. They could have a genetic disorder. They could have a learning disability. They could have physical challenges. So we're all unique, but these individuals are unique, oversized or supersized, because they have sort of that underlying, for the most part, genetic or sort of a birth, so it's something they were born with, but they also then have other sort of challenges that are layered on top of that. So we really try to look at the individual need and support them. So,
to your point, I mean, you support individuals with these complex challenges with more than one, disorder. So what is unique about Safehaven's approach to, caring for these individuals with complex needs? What is?
I think for sure, most organizations in the sector, the model of care is more working with PSWs, working with unregulated staff. The model is very different. I think with our model of care, and that's where I think I've been able to use my expertise as a nurse, is really looking at how do we embrace the complexity of these children in the community, and what type of care model do they need? So who do you need to care for these individuals? We have unregulated residential support workers who are fantastic, and they learn so much, and they're part of sort of that sort of whole model. But there's another layer which involves critical thinking. So when you're taking care of children who are on different types of technologies for sustaining life, you need to have a skill set that requires those individuals to have critical thinking. And critical thinking is really important, especially to be able to respond to changes in conditions, to be able to know how to react, how to respond, understanding what the risks are. If you don't have that knowledge, then you don't really understand how to respond. So I would say the uniqueness of Safehaven is that we have that spectrum. So we do take care of children who are developmentally delayed. But we also have the children that I think are in, if you think of that top 2 to 3% who are very complex, who you need to have a very skilled worker. We have children that actually have to have one-to-one care 24/7. Just the nature of their complexity requires them to have a specialized nurse with specialized skills 24/7 taking care of them. And that's what is unique about us. I don't think you will find this type of model anywhere else in Ontario. And even in Canada, the type of model that we've created is even unique in the Canadian landscapes. Certainly, I'm involved in many national groups, leading community of practice, and I think that focus is really unique. And we purposely did that because we recognize that families, in order to keep families together at home, you had to have that type of model so that the families could get that respite.
Wow. So, we're really lucky to have Safehaven here in Ontario and, taking care of these individuals with complex needs. So walk me through now the selection process, because I understand we have a population of individuals with complex needs, multi-challenges, some of them, right, as you explained. But there must be a selection process. I would assume, right, that demand exceeds supply. So how does a family access your services? Who covers these costs? I mean, there are costs associated with caring for individuals with complex needs. Could you just walk me through that process a bit? So our audience understands
absolutely
what's involved?
Yeah, and I think, again, there is a uniqueness in the approach depending on if you're a child, so if you're under 18,
right,
or if you're over 18. So we know in Ontario we have a developed system with Developmental Services Ontario, where those individuals, as they're aging into adulthood and getting ready to transition, they are assessed and they are looked at what are their needs. If they need residential care, they go on a waiting list for that residential care, and they are assessed for what supports they need. In terms of the children, I would say a lot of our referrals come directly from the source. We do have systems in Ontario where people who have more complex needs as children are assessed. And we get actually contacted from those agencies to say we have a child who needs some support. And, can you provide that support? We also get, even from social services, we do get contacted when there's situations where some of these children may need to have either residential or respite care, depending on the living arrangement, either at home or if it's fragile. So we get contact directly from that source. But we live in a province where we have world-class medicine. We're here at Bloor and Dufferin. 5 kilometers from here is one of the best hospitals in the world, right? SickKids is number one Phenomenal. In the world.
Right.
And also we have University Health Network, which is next door, which is number 4. Part of living in an environment where you have this high degree of specialization when it comes to care means that typically maybe other areas of the world or the country where they don't have those resources, those individuals may not have a fighting chance. But being close to, world-class care, kids that are born with complexities or complex care needs actually are able to receive treatments and technologies that, maybe in other parts of the world they can't get. So we do partner with our hospital partners. that are very close to us. We've worked with sick kids. We do have combined education programs, making sure that the approach that they use in those settings, we can then translate it and apply it to here. We work with our rehab partners, Hull and Bloorview. So there's a very sort of, I would say, there's a commitment from Safehaven's perspective to partner and make sure that we provide solutions that help sort of address those gaps and that those individuals do receive the care. So sometimes referrals could come from them.
Right.
During the pandemic, there was situations where, families were not coping, families who had, the entire family had COVID. And mom and dad were hospitalized. We had families where one parent was in intensive care. There was nobody to take care of their children. So we actually partnered with them and we provided what would be considered like urgent respite care. So there's a lot of those scenarios. So there's many sort of ways that people come. We do keep our own wait list. We have families who reach out to us.
Okay.
Just before I came down here this morning, I got an email from a gentleman saying, "Susan, can you help us? We have some children that we know need some support." So, people understand us. They understand what we're doing. So we do get it from multiple sources for the children. I think for the adults, it's a little bit, it is more sort of, I would say, structured. Because of the Developmental Services Ontario. But there's definitely are some agencies for children that we work closely with. But I get contacted on a regular basis as saying, "Can you help?" And not only in Ontario, I get calls from people from out of province saying, "Hey, can you help us problem solve? We have this complex case."
I could see the family, starting to look at the 0 to 17 years of age bracket for their child, with complex needs for support, and probably not get it till, their adulthood, right? Because if there's no space, there's not a lot of opportunity. Right. So that's why we need to protect the spaces that we do have for children. And I think for the most part, the families that we interface with, they want to keep their children with them. They want that sense of family is important. And, having that child who has a complexity or a disability is important, that they're part of that fabric. So, respite is amazing. I was going to say that's why the respite is kind of good. They get a break from, the normal 24/7.
They get a break, right? They get a break. But also many of these families have other kids. So,
that's right.
When they can't travel with that child has a disability, being able to have, a week's break where they can take the other family members maybe for a holiday or do something and try to create some normalcy with the other children is really important. So, I think that notion of keeping the family together is really important. So respite is critical. Where I think that people get challenged is as they get older. Mm-hmm. What I'm dealing with is a lot of families who have respite and then their child now is 18. They're on the wait list. There is a process for that to, for them to acquire space or even, they can access some respite, but it is challenging because they're getting older.
Right.
So they're thinking about their own sort of, mortality and, what's going to happen to them.
Personal growth.
Yeah. What's going to happen to their child after, they're no longer able to care for them. Right.
So Susan, let me ask you, the current system in Ontario, is it sufficient enough to meet the needs of these very special people? Are they doing enough in your mind? Or
what I think, there's areas I think that we're doing in the province where I think we are leaders. Mm-hmm. Do I think there's definitely opportunities for more? We know a wait list of 14,000 people for developmental services for adults is not something anybody is proud of or we want to stand behind. I know that there's a real strong focus now to really trying to rejuvenate and revitalize sort of what does the care model look like? How can we have more person-centered funding and help these individuals. So I do think there is a focus, but there's so many competing priorities and demands. When I think about the work that we've done here with children, we're getting ready to introduce a new transitional program for children who transition from hospital into the community. That's being funded by the Ontario government. I think that's great. So there is an awareness. I think there's a movement towards more integrated care models. So I think that we're excited by that. And I know I've been meeting with key individuals in the ministry and in Ontario Health to say, how can we do more? So it's not something that we can turn over quickly, but I think there is an acknowledgement that we can do better. So are we happy with where we are today? Probably not. But I think as long as we have that engagement and a desire to build something different, we will always advocate for a better system of care. I think the model we're creating in the community with sort of our housing and having, looking at these individuals in the context of where they live. I think most people think of your personal health. You don't really think about the notion of a home. But for our population, the context of your own health has to include a place to live. So for us is really thinking about that idea that when we're caring for our individuals, we also have to plan not only for their medical care and their treatments and all of that, but also need to think about where they live. But on top of that, our goal is to really help them live their best life. So what does the best life mean? What does it look like? How do we build spaces that are inclusive? How do we embrace technology that helps them live the best sort of future they can? So I think those are key pieces. But foundational is ensuring you have a good sort of care model. Somebody can actually care for you, have a place to live, but that higher function. So you actually experience as much joy as you can, despite your limitations, is a critical component for us. So it's not just a bed or a place to live. It has to be a place where these individuals thrive.
I really like that, to hear that, because as you know, I have a son with special needs as well. And to be able to find support, the housing and the support services is great, but it has to be in the community that they grew up in. People forget that, So
it has to be.
You know what I mean?
Yes.
I certainly would want to be told where to go to live, right?
Exactly.
So when I think of my son, and his conversations with me are in the nature of what you're going at. I said, I'd like to be able to stay here,
yes.
in the community that he grew up in, right? Regardless
exactly.
of this.
Well, and people know him. He goes out, they know who he is.
And there is a movement now, right? There is a
yes.
movement to understand, engage in the community, understanding choice and allowing for independence, but knowing that you have some say in it, right? So
some say for
and
sure.
I think that it's been a misunderstanding as well that individuals with complex needs do have the ability to make choices.
They do.
And I think that way the work you're doing is showing that, is demonstrating that.
Right, and I think the thing is that sometimes people look at people as disabled and they dismiss them. They don't really
Absolutely.
see them as being a part of an integrated environment. They look at them as being disabled as being a weakness. And I think they're
fearful, right?
They're fear, but the more you're around, I think people who are disabled, all you see is strength. And I think that's the piece that we really focus on. So your notion of choice, one of our new strategic plan that's coming out in April is expanding capacity and choice.
Yeah. Exactly.
And choice as much as they can. If you can nod, if you can blink, if you can say a few words, those are so
music
so
to my
important.
ears. I love it.
So important, right? And I think that as a society, we've been very dismissive. We've marginalized people with disability. And I think that we've really focused on, you've probably read about our We Belong campaign.
I was just going to ask a question. You just lead on expert.
The We Belong
Tell me about the We Belong campaign, because
Yes.
what is it all about? Because I'm really excited about it.
Yeah, so we started, I think when I first came to Safehaven, there was a sense that the name, the Safehaven Project for Community Living, was very misunderstood. We had people who thought we were a women's shelter. People said to me, when is your project finished? So they saw it as something with a start and an end. So we actually work with Miami Ad School, a group of students, and went down a path of really looking at the name, who we are, what we're all about, and sort of just our whole sort of branding. And part of what came out of that was there was a thinking that maybe we should think about changing the name. So one of the options that came forward was We Belong. And I think that it was too much for, I think, the leadership and the board to switch the name to We Belong. So going from the Safehaven Project of Community Living to a We Belong. But we decided to basically, there was something very powerful in Safehaven. So we really sort of looked at then rebranding it as Safehaven, not the whole, the long length
Sentence
of
structure.
Yes. And then really putting that notion of We Belong is a bit of a tag.
Yeah.
So Safehaven, We Belong. And what was fascinating is then the We Belong, as you see it, it really speaks to the advocacy work. Like we're change agents, we're advocates, all kinds of things. And then we've really used it to profile some of our clients. Like we like going to the movies, trying to humanize who we care for. Because to our prior discussion, a lot of people really, there's a bit of dehumanization sometimes with people with disability and marginalization. So this We Belong really helped them to empower them to say like who they are.
Grasp the moment.
Yeah,
Grasp
so
the idea.
that really helped us in terms of that advocacy. But I think it became very powerful during the pandemic. I think that the pandemic has caused everyone to sit back and question, who am I? What am I all about? What is my purpose? Why am I here? And I think that the focus on, protecting, maybe populations and individuals who are sometimes sidelined or marginalized or vulnerable has really taken another look. So we've had a lot of people reach out to us and say, I want to help. I want to become involved. What can I do? So I think that the whole We Belong campaign really took a really strong movement forward during the pandemic. And, it really excites me as well when I see my partners. Sometimes I'll get an email back and say, we are your partner. So people really sort of that whole we belong sort of piece and the filling in the blank kind of thing really took on a strong message for not only Safehaven, but for other people who we work with in the community. So we're excited. It's meant to really sort of bring that whole advocacy work forward.
Well, I think you do. I think Safehaven is a wonderful name. I think
it is.
You brand it. Indigo did. Nobody knew what Indigo stood for years ago, and of course, with the service and whatever, the messaging came out, and the tagline, "We Belong." This reminds me of that old cliche, like "No man is an island," right? We all live together, and we must cohabitate. And individuals with complex needs, or individuals that required, friendships and partnerships, and to be engaged. So I'm really glad that seems to be the way we're starting to think now. There's a lot of campaigning on television and media. So you're right. I mean, it's good. It's good. You go in the right direction. I also read about in your 21-22 impact report about your plans for the future Center of Excellence. Is that something you'd like to talk to us about?
So I think, again, the site that you're here today, this is kind of right in the heart of Davenport. It's right at Bloor and Dufferin.
For people who haven't been, there's Bloor and Right in the downtown core.
Right in the downtown core. It's an amazing
Near the University of
community.
Toronto.
We have a long history here. Our community has embraced us. When we did our sort of engagement with our families and our clients who could speak and tell us what they wanted, they said they wanted to be in the thick of things. We do not want to have respite or residential facility on a green space out in the country by ourselves. We want to be a part of the fabric of the community. We want to be able to take transit. We want to be able to go to the Blue Jays.
The museum down the road, the art gallery.
Yeah, and that's been an important part of our strategy in terms of thinking about where we go and where we expand, is that we are in communities where our clients are a part of that community. So loud and clear, beautiful messages from who we serve saying, this is what we like about this center is we're here. We're a part of it. This is our place. So part of that future is really taking this place and building that center of excellence. So really the center of excellence will not only focus on the bricks and mortar, and it will have housing, but it's also, when I think about a vision, I'd love to be able to see a place where we actually study and learn and educate
it's a great idea.
The community about disability. There's not enough research in this space. There's not a lot of, I think the education, when I look at some of my partners, they're doing an amazing job with their strategy in terms of education. And I think we all have a role. I feel very compelled that we have a role to actually, provide education and research and really help people understand more about who we serve. And maybe that'll take away some of the fear that you talked about and, some of the discrimination that exists in society. So we're very excited. We have a grant from the Canadian Mortgage Housing Corporation, which is the National Housing Strategy. We're working on our seed grant currently. And we are planning for creating a center where we're also trying to bring the community in. So that notion of community, how do you bring the community in?
Right.
So not only looking in, say, the community we live in, what's there, but then what's missing, that can be a draw so that we create that tension between all of our community members and our clients so they work and live in harmony together. And also another big component of that, it will be technology. I think we have not really, we've just scratched the surface on how technology can be a huge enabler for people with disability. When I think about some of the things that, the touchscreen technology, some of those things that were, developed for mainstream, and how now this type of technology is enabling some of our clients to actually have a stronger purpose and work and do different things. There's a lot of opportunities around technology that we don't really know. So there will be a lot of focus on sort of how we use technology as well in terms of helping our clients really advance their goals and dreams.
Probably great though, because when you build your vision, right? I mean, it'll be a place where families, even waiting to transition, right, their loved ones.
Well, and I think that's a part of our strategy is that, when I said that prior we're under 18 and now we're over 18. So we really feel that we can actually create that seamless transition.
Right.
So, what I see is that people get in a lot of crisis when they reach 18. Navigating that system is very complex for families. So if we can actually create a seamless, integrated transition for people with disabilities and complexities, why would we not do that? And it should be seamless. It's just we've created these silos and artificial barriers. Nothing's really changed with the individual. But the fact is when you reach 18, the world changes. your school system. You can go up to school till you're 21, but there is so many changes. And in terms of the systems that are currently in place to help, is very limited.
Yeah, you hit a good point. When I wrote my book, The Waiting Game, I talked about the post-21 era, right, which is so significant. It's like a tsunami to families, right? Because all of a sudden you lack all this information. Your stress level goes up, and what am I doing now? Where's my loved one going to work? Where are they going to go? Who's going to do this, right? Who's do that, right? So in school, we've settled. We leave it to the school system. We rely on them, right? But at some point in time, the responsibility shifts.
The responsibility shifts,
right?
And now they are adults. So being an adult is a lot of other challenges. And I think for parents who have children with disability, when they experience the children's system and you get into that comfort and that reliance on what currently exists, when you reach 18, you think that, there's going to be a system that's going to be similar to
the school,
the school, but it's not.
Or the pre-21.
So that's where the crisis hits, because there really isn't a lot of systems to transfer to.
It's a shock.
It's a shock.
It's a shock, right? Susan, great conversation. But before I let you go, before we close our program, what's the one personal message or several messages you'd like to leave the audience with? And I know there's been some developments too in your world. Perhaps you could end our program with.
I think, thank you. This has been great. And like any way that we can be out there and advocate for people with disabilities, we'd love to, to share our work. We're very excited. We have a new strategic plan that will be launched in April. So maybe we'll get another chance to talk about that. But our focus is on creating a more inclusive world. So we're really looking at how do we work to create a more inclusive world where our clients are really totally engaged and feeling like they're a part of that. So stay tuned. We're really excited about that. We're also coming off the pandemic. We've done some amazing work to help support the Toronto region around infection prevention and control. So we're very pleased. We've been acknowledged with some national awards in terms of our work. And so our goal is to create a more compassionate, inclusive world. So we're excited to be with you and discuss what we're doing. You will hear us over the next few months. We have some more engagements to talk about leadership. And our advocacy work will definitely continue. And we're just great to partner with you and get the message out there. So thanks.
Well, congratulations to the recipient of the 2021 Children's Organizational Award.
Yes, so we won.
Congratulations.
I think for our work with the province, we won the OASIS Award for our work around the pandemic. And we also, with the Children's Healthcare Canada, we also were chosen as the Organization of the Year. And I am so proud of the staff. I know I stretched them. I know I pushed them, and they're all sort of enjoying this post-Wave 5 pause where they can rejuvenate their kind of themselves and get them ready. We hope we won't have any more waves, but we're very proud of the work we've done, and we know that it has saved lives and kept people safe.
Well, I'm certain all these milestones and achievements are because of your great staff behind you, but it's also a tribute to the leadership. So congratulations to you.
Thank you. I appreciate it.
Thank you for coming on our program, Cribwolf Talks.
Great. Thank you.
We look forward to having chats in the future about this very project here at this location, to seeing it manifest into something wonderful.
That's great. Love to share, and let's work on creating a more inclusive world.
Thank you, Susan.
I hope everyone found our talk with Susan Bisaillon very informative. I know I certainly did. We need to increase and improve housing options for people with developmental disabilities and medical complexities, to exploring intentional approaches to fostering social inclusion with a diverse group of stakeholders. Thank you to Safehaven and Susan Bisaillon for the work you do. If you missed any of our previous podcasts or webcasts, visit www.cribwolftalks.com and on social media platforms. Should you wish to share your story or be part of a future podcast or webcast, please send us an email to info@cribwolftalks.com. Thank you for listening to today's episode of Cribwolf Talks. I'm Lino, and remember, those who cannot help themselves need our help.